This week is Food Allergy Awareness Week. We've all heard about peanut-free zones and the complications that can come with a food allergy, but there is a lot more to it. There is an organization that works to spread the word around West Michigan, and joining me for more on that, Dr. Sara Uekert with Grand Rapids Allergy. Thank you for joining us.
Thank you for having us.
Let's talk a little bit about allergies. It's been quite a season. I know a lot of people have been seeking help to deal with allergies because of this mild winter. Have you seen an increase?
We've definitely seen an increase, not just this year, but last year also. It seems like our seasons are changing. We're having more allergies.
Right. So what would happen? Why is it that makes it what is it that makes it so much more difficult for people that may have had a mild allergy before, but now they're really dealing with an increase in all of those symptoms? They're just worse than ever.
Sometimes that early warm-up that we had kind of gets your immune system revved up, and then we get a cool down, and when it all comes back again, your immune system goes crazy.
Are there some misconceptions about allergies, do you think? What do you think those are? I know a lot of kids in classrooms deal with the peanut allergy now. Do you see more and more kids getting peanut allergies? Because I don't remember that when I was younger, having so many kids with peanut allergies.
Allergies across the board are on the rise. So not just food allergies, environmental allergies, asthma, it's all increasing. So there are more kids with food allergy now than what there were before, and peanut allergy in particular.
It's hard to control, really, because you have so many kids in the school systems, and you see the peanut-free zones, and it can be difficult to manage.
And that's why Food Allergy Awareness Week is there, because we want people to not be frightened about food allergy. You know, if you have a child in your class that you find out, oh great, now I can't bring peanuts to school. Talk to the parents, you know, be aware and say, what can we do to be safe so we can make our friends safe?
Tell me a little bit about the program that you have to educate people about food allergies, because a lot of people may just be going on what they think or what they've heard somebody say. What do you do to educate people?
We go into schools, we go into daycares, we go to health clubs, basically any place that takes care of kids and needs education.
One thing I've heard about, too, is that some classrooms want to put EpiPens in the classroom to help kids that we were talking about dealing with peanut allergies, for instance. What are your thoughts on that?
Well, the way it is right now, you have to have a prescription in order to have an EpiPen at school. And the concern is, what about those kids who haven't been diagnosed yet? Maybe they have a bee sting allergy. They get stung on the playground and they're having a life-threatening reaction and they don't have an EpiPen. And schools don't have those right now. So I think it'd be a great idea to be able to provide that in schools, but then you have to provide the education behind it too.
Right. And so the teacher or the school nurse or somebody would have to be able to act quickly and be able to handle that. Well, it would be kind of controversial, I would think, because what if it's a misdiagnosis, I guess, on the behalf of the teacher or something like that? Could it hurt a child?
It doesn't, and that's what we tell our parents of the children who have food allergy. Parents are worried about using the EpiPens on their own child who has a known food allergy, and we tell them it's your body's natural adrenaline. It's in a synthetic form, but it's not harmful. It's something that can help you, and it can be life-saving, so it's an important tool to have.
It's an interesting conversation that's out there. Dr. Sara Uekert with Grand Rapids Allergy, thank you for joining us.
Thank you.